When you attend RSNA 2023, our industry influencers and radiology trailblazers are set to help you embrace what's next in medical imaging. Imagine what new medical imaging practices and technology can teach about collaboration and innovation. We have everything you need, all in one place, as we help you explore how to lead through change. Join us November 26th through the 30th for the biggest week in radiology, in person, virtually, or both. Early bird pricing is available through October 4th. Register now for RSNA 2023 at rsna.org/register.
Hi, everyone. This is Dr. Celina Nahyun Jo, one of the trainee editorial board members in Radiology Imaging Cancer. I'm a radiology resident at the University of Texas Medical Branch at Galveston. We are launching a new podcast series where we summarize interesting articles into a bite size. This podcast provides background knowledge for everyone to understand and enjoy oncologic imaging research on the go. This is Bite Size Research for Radiology Imaging Cancer, July 2023 issue. This is a review article from Mayo Clinic in the United States. The first author is Dr. Brian Burkett, and the senior author is Dr. Tuba Kendi. The title of the article is A Review of Theranostics, Perspectives on Novel Approaches and Clinical Advancements. Theranostic is a combination of diagnostics and therapeutics that have been mostly used in cancer imaging and to treat various types of cancer. Recently, US FDA approved radionuclide therapies using lutetium-177 tetraazocyclidodecane tetraacetic acid octreotide, abbreviated as dotatate, and 177 lutetium prostate specific membrane antigen, abbreviated as PSMA. This article is very detailed and covers from the basic to an in-depth review of the key areas of ongoing clinical advancements in theranostics, including upcoming clinical trials of innovative radiopharmaceuticals, methods for calculating dosimetry, imaging techniques for different radionuclide therapies, expanded applications of current agents, and emerging concepts in the field. Radiopharmaceuticals are a combination of radionuclides and a ligand. Ligand includes small molecules, peptides, antibodies, or particles that bind to a target in a body, such as cell surface receptors. The radionuclide portion acts as GPS sensor or signal lights, so we can detect the location of radiopharmaceuticals. The intensity of radioactivity from these molecules bound at the tumor expressing certain targets can be imaged using SPECT or PET scanner. This way, we can diagnose, stage, and confirm the therapeutic delivery of the molecules, calculate effective radiation delivery, or follow up treatment response. Understanding types of emissions is important for us to understand the potential therapeutic roles of radiopharmaceuticals. Beta particles travel long distance, approximately 2 to 12 millimeter, equivalent to 20 to 120 cells. Clinically, these are used in lutetium-177, iodine-131, and yttrium-90. Alpha particles travel a shorter distance, 50 to 100 micrometers, equivalent to only 1 to 3 cell length. Auger electrons travel an extremely short distance, in a nanometer to micrometer range. They are a form of beta particle emission. Radiopharmaceuticals can exert anti-tumoral biological effect through multiple mechanisms. These include direct damage to DNA, crossfire effects to adjacent tumor cells, and indirect effects through generating reactive oxygen species and induction of immunogenic cell death. The beta particles that travel long distance result in a crossfire effect that is advantageous in larger tumors with intralesional heterogeneity, as it irradiates the adjacent tumors that do not express the target molecules. Beta particles exert therapeutic effect by generating reactive oxygen species that cause DNA damage. Such damage leads to cell death response or DNA repair response, both of which depend on the presence of oxygen. For this reason, beta particles have lower efficacy in ischemic tumors due to hypoxia-induced cellular defense mechanisms. On the other hand, alpha particles are more cytotoxic and cause irreparable double-strand DNA breaks. At the same time, alpha particles induce a stronger antigen T cell immune response, which is oxygen independent, which creates greater ionization events and reactive oxygen species compared to beta particles. Agar electrons travel a very short distance, which can be particularly helpful for smaller tumors in a sensitive area. Theoretically, it can be highly lethal for tumor cells when incorporated into the cell DNA. However, the application is yet limited due to its needs to reach the cell nucleus to cause DNA damage. The author introduces us to the use of radionucleotide therapies currently in clinical use and the expanded use of now available agents. In this summary, I will briefly summarize two radiopharmaceuticals introduced among many. Somatostatin receptor targeted radionuclide, particularly SSR2A expressing neuroendocrine tumors of the pancreas and midgut, can be imaged with gallium 68 dotatate, DOTANOG, and DOTATOC, 111 indium octreotide, or technetium 99M octreotide, and treated with 177 lutetium dotapeptides. The neuroendocrine tumor therapy, or NETTR NETTER-1 phase 3 trial of 177 lutetium dotatate in patients with advanced midgut neuroendocrine tumors demonstrated increased progression-free survival at 20 months of 65.2% versus 10.8% in control. SSRs are expressed in a variety of neoplasms other than GI neuroendocrine tumors, as well as non-neoplastic processes. Ongoing clinical trial use 177 lutetium dotatate to treat malignancies such as glioblastoma, esthesioneuroblastoma, breast cancer, small cell lung cancer, and Merkel cell carcinoma. Using 177 lutetium dotatate therapy in paraganglioma and meningioma are the two areas of rising interest for medium-sized tumors, whereas Y90 is for larger tumors. Meningiomas are classically gallium-68 dotatate avid, potentially serving as an ideal treatment target for radionuclides coupled with dotatate. Utilizing the treatment of refractory meningiomas with beta-emitting SSR-targeted radiopharmaceuticals has been described in numerous reports. Forthcoming clinical trials will provide more information about the efficacy of this treatment strategy. Prostate-specific membrane antigen, or PSMA, coupled with radiopharmaceuticals, target a transmembrane protein expressed in the prostate cancer. The phase 3 VISION trial showed that the patients receiving 177 lutetium PSMA 617 had increased progression-free survival and overall median survival of 15.3 months versus 11.3 months compared to the patients receiving standard of care treatment alone. The 177 lutetium PSMA 617 was recently FDA approved for mCRPC. Despite its name, PSMA is expressed in many other neoplasms. These include adenoids, cystic carcinoma, salivary gland neoplasms, and other tumors with associated neovasculature. Thank you for tuning in. This is Bite-Sized Research for Radiology Imaging Cancer, July 2023 issue, and I am Celina Nahyun Jo. Please check out the latest Radiology Imaging Cancer issue on our website for more interesting articles.